Hello, I'm Brigadier General Deidre Tahan. Welcome to our second episode of BAMC MED Talk. This month, in the celebration of National Physical Therapy Month, I'd like to focus on the role of physical therapists and the benefits of physical function and movement for your health. As a physical therapist for nearly 30 years, this month is especially meaningful to me. I am passionate about this field and its incredible impact on health and wellness. This is also a great opportunity for me to express my appreciation to our dedicated BAMC physical therapists, physical therapy assistants, physical therapy technicians, and students for what they do as movement experts to prevent injury and help our patients get back to a healthy lifestyle. They are essential and valued members of our team. Today, we are excited to have an esteemed panel of PT experts who will be discussing the benefits of physical therapy and activity, access to care, and how physical therapy affects mission readiness. Today's panel includes Lieutenant Colonel Alden Taylor, San Antonio Market Physical Therapy Product Lead, Wilford Hall, Orthopedic and Rehab Flight Commander, Lieutenant Colonel Chad Flick, Chief of BAMC Physical Therapy Services, Major Andrew Golden, Assistant Director of the Army Baylor University Doctoral Fellowship in Orthopedic Manual Physical Therapy, and Dr. Teddy Ortiz, Supervisor for the BAMC Soldier and Training Clinic. Thank you all for being here and taking time to address this important topic in our questions. Without further ado, let's start with the first question. Every October, we celebrate National Physical Therapy Month. Why is it important to raise awareness about the benefits of physical therapy?
I'll take this one. So ma'am, in many ways, I feel like physical therapy is a lot like the owner's manual for your vehicle. You don't really think about it until you need it. And when you do take a peek at it, you can find out all sorts of things that you didn't know. The normal aches and pains that people typically associate with the normal process of aging may be related to a treatable condition. And limitations in mobility may lead to further problems down the line. So in essence, I think that physical therapy can go a long way towards helping people get rid of those aches and pains and increase and improve that mobility to help our members be as ready and resilient as possible, because we have a responsibility to be ready for the fight, whether it's in garrison or overseas or in the deployed location.
Awesome. So our second question for the panel is, what are the roles of physical therapists and physical therapy assistants, and what can they treat?
I'll take that one, ma'am. So physical therapy treats a wide variety of injuries and medical conditions that impact normal function, strength, endurance, mobility, and it's not just related to sports, but even just activities related to normal work, activities of daily living. And the physical therapist's role in that is to conduct an evaluation through a thorough review of systems, patient history, and physical exam, in order to determine what that diagnosis is and to develop a treatment plan and goals that are aligned with what the patient would like to achieve. The physical therapy assistant's role is then to follow through with that treatment plan and then to recommend any adjustments or progression based on how that patient's progressing towards those goals.
Excellent. What are the benefits of physical therapy?
Sure, ma'am. I'll speak to that. I think there are two primary missions to physical therapy. One is injury rehabilitation, which most people are familiar with when they think of physical therapy. And so, we take it seriously that if someone's limited by a condition and it's affecting their work or their exercise or activities, their hobbies, it's our job to get in there and help them get back to those things. And that helps promote both individual readiness and then our overall medical readiness for the unit. And then maybe what people aren't as familiar with is that we have a mission for injury prevention as well. And so physical therapists always have their eyes out for, looking at how people do their jobs or looking at how people train and, unit training plans. And we're looking, can we make recommendations or changes to what's going on to help maybe reduce the risk of injury to begin with?
Thank you so much. They say physical therapy is all about physical function and movement. Why is that so important to our well-being?
That's a question that's often simple to answer but difficult to maintain. The simplest answer is that our body is a well-oiled machine that's designed to move in multiple directions and do extraordinary activities. Consider a professional sports car that sits in a garage for a long period of time. It's not being well maintained. When it's time for it to perform at its high level, it's going to have some problems. We're similar in that if we continue to stay in the way that society is moving, a sedentary lifestyle, or being in poor postural position. What I mean by poor postural position is sitting hunched over a computer or laptop, even your cell phone for 40, 60, sometimes even 80 hours a week, and then being asked to move out of that position, you too are going to have some problems. I think maintaining physical function and movement, what that does is prevent us from having those problems and allows us to function at a level that's our body's designed to.
Excellent, thank you. What is the right amount of physical activity people should be getting?
So, ma'am, I'll take that one. So the guidelines, is, according to the American College of Sports Medicine, indicate that healthy adults ages 18 to 65 should engage in moderate exercise for a minimum of 30 minutes a day for at least 5 days a week, or vigorous exercise for at least 20 minutes for 3 days a week.
Thank you so much. Is there anything we can be doing to prevent such things as back pain and knee pain?
Yes, ma'am. So a lot of injury prevention comes down to a good balance between mobility and strength, with emphasis on proper form with activity and good posture when at rest. Whether your lifestyle is really filled with a lot of physical activity through the day or sedentary, it's recommended that you do practice that good form and posture when you're doing your activities. And then with just investing time into a good performance exercise plan so that you can prevent some of those injuries. And then as part of the holistic approach to health, also having a good diet and good sleep hygiene.
How do the people that rely on Team BAMC to get their physical therapy access our care?
Yes, ma'am. So most people are familiar with the traditional way of, you can go see a doctor and get a referral, and that's an option. But military PT in general has always been a pioneer of what we call direct access, which is your ability to come and just see us directly. And so if you're active duty, there are a few options. You can come to one of our clinics and schedule an appointment there. Camo also has some bookable appointments either through the phone or online, and so active duty have access in that way. If you're a beneficiary, we've got a few options as well. Within the primary care clinics, there are some embedded physical therapists, and so as you go to that appointment to get something checked out, you may be able to interact with a physical therapist immediately. And then maybe the last option that people aren't familiar with is if you're a permanent party here, active duty or beneficiary, on the second floor of Moreno Clinic, there's a clinic called IPU, and every morning starting at 8, they see acute musculoskeletal injuries. And so if you have a new condition or something that you would like checked out, permanent party can go and get that checked out at Moreno Clinic.
Excellent, so thank you so much. How does physical therapy contribute to overall readiness?
I think this is a good question because it's one of those that I think physical therapy, as well as many other holistic approaches, help meet the 4 pillars of Army readiness, which include manning, training, equipping, and good leadership. I think the most obvious is manning. If you're injured and you're unable to perform, you're not going to be able to be part of the team. And then when we go with the next one, which is training, if you're unable to perform the actual exercises, it's hard to be part of the unit and train to be effective. When we go ahead and think about equipping, if you're unable to utilize the equipment to be able to perform as needed, then we have a difficulty there. And then lastly, I think we've all had a situation where we've had some pain, whether it's a physical injury or something even like a strong headache, that prevents you from focusing. If you're unable to focus, it's hard to become that good leader. And honestly, without strong, good moral leadership, the whole mission is compromised.
Thank you all so much. This concludes our question and answer portion. A special thank you to our distinguished panel members for their knowledge and their expertise. I hope this information was valuable and helps you better understand the important role of physical therapists and physical therapy assistants. Thank you for watching the latest episode of BAMC Med Talks. Stay tuned for next month's episode.